Hello, thank you for visiting this training video hosted by DXC Technology. Today I'm going to show you how to enroll a new group in the Provider Management module for Vermont Medicaid. Before we begin, please note that this video is intended for informational purposes only and does not guarantee approval of your enrollment in Vermont Medicaid. If you have further questions regarding Vermont Medicaid's enrollment criteria, please contact the Enrollment Department at DXC Technology at 802-879-4450, option 4, or email us at vtproviderenrollment@dxc.com. For today's presentation, I'm going to start on the homepage of the Provider Management module. You can access the link to the module by visiting www.vtmedicaid.com and click on the Enrollment tab. To start a new application in the Provider Management module, I'm first going to click the Menu button that's located on the top left hand of your screen. Under that, I'm going to hover over Provider Enrollment, and I'm going to click on New Enrollment. Once I click on New Enrollment, a welcome page is going to present first, and this just gives you some more information about what you may need in order to complete your application. Once you're ready, you can hit the Start button located on the right-hand side. The next page that's going to come up is the registration page. Every application is required to have its own registration. This registration will assign an application tracking number, or an ATN, which is unique to each application. You can use the application tracking number to resume your application if you're not able to submit it in one sitting, or to check the status of your application once it's been submitted. So in order to register, you're going to want to enter in your email address and a password. It's not required that you enter in a provider reference. However, if you wanted to enter some identifying information in this field that will follow you throughout the application, you can feel free to do so. Once you've entered in the registration information, you can click on Register on the bottom right-hand corner. This is going to launch you into a brand new application. The blue box that pops up just lets you know that your registration is complete for this application. It's going to provide you with that application tracking number, and it's going to let you know that it sent the application tracking number to the email address that you've registered with. A few things to note before we begin our application. The application tracking number follows you throughout the application and is located on the top of the screen. If you need help on a specific page or panel that you're currently working on, there is page level help, and that's available by clicking on the blue question mark located in the top right-hand corner. If you need help regarding a specific field and what information to enter there, you can get more help by hovering over the gray question mark located on the top of the field. Anything marked with a blue asterisk is required, so you will be required to fill out the information before you can save and continue on for the next page. The first piece of information we need to fill out is the enrollment type. As stated in the beginning of this presentation, we are doing a group application today, so I'm going to drop the box down and I'm going to select Group. Once you've selected an enrollment type, a warning box is going to come up to let you know that once you have saved and continued on past the first page, you're not going to be able to go back and change the enrollment type. So you want to make sure that the enrollment type that you've chosen is the actual enrollment type that you want. The next piece of information we're going to fill out is the provider type. So I'm going to drop the box down again, and today I'm going to choose Physician. This is also going to bring up a warning box once again, letting you know that once you save and continue this first page, you're not going to be able to go back and change the provider type. The reason for this is that you'll notice that once I chose my enrollment type and my provider type, there were panels that populated at the top. Once I save and continue the first page, the entire application from that point on is tailored to these two pieces of information, the enrollment type and the provider type. This is why you can't go back and change these pieces of information once you've selected them. The next information we're going to give is the effective date. You can request an effective date up to 1 year in the past or up to 90 days in the future. Under the initial enrollment information will be the provider information. So you're going to give us the legal name of your group. If there is a tax name, you can provide that information. It's not required. If you have a DBA, you can enter that here. You will be required to enter in your group's MPI number. and you'll also be required to enter in your tax ID. Once you've entered in that information, you can head down to these 3 questions located below. The first question is, are you currently enrolled as a provider? If you were to choose yes here, it's going to give you a red warning box that asks you if you're actually here to revalidate. Since you're currently enrolled as a provider, you may be wanting to revalidate that enrollment, and this is not the avenue to do so. If you are here to revalidate and you choose yes, it's going to bring you back to the home page so you can start the revalidation process. We are trying to do a new application today, so I'm going to hit no. It's also going to ask if you were previously enrolled as a provider. If you choose yes, you're going to indicate to us the 14-digit service location ID from your previous enrollment. And last, we're going to ask you if you're Medicare enrolled. If you click yes, you'll notice that nothing populates for you to enter. However, because we chose yes, later on in the application, it's going to ask us for that Medicare information. So I'm going to leave it as yes today. The next piece of information you'll need to provide is the programs in which you're enrolling. Currently, Vermont Medicaid only has one program to select, which is fee-for-service only. So you're just going to simply drop the box down and select fee-for-service only. Next, we're going to ask you for some contact information, and this would be the contact information regarding this specific application. So if DXC or the state of Vermont has any questions regarding this application and this enrollment, who would we contact? So you're going to enter in the name and the address. And you'll notice that once I tabbed through the zip code, it's going to process through the United States Postal Service software to validate the address I provided. It's going to give you a suggestion located on this line here, and you'll notice that it entered in the last 4 of the zip code for me. I'm going to accept these changes today by clicking on anywhere in this line item. However, if you did not want to choose to select the changes, you could simply hit the X button that's located on the top right-hand corner. I need to select my phone type. I'm going to choose my work for today and enter in that information. If you have an extension or a fax number, you can provide that here. Now you'll notice that as I'm entering in this email address, the email address is not asterisk, indicating that it is a required field. However, just below the email address is your preferred communication. And you have the option to choose email or mail. If you choose email as your preferred communication, you will need to enter in an email address in order to move forward. You wouldn't be able to choose email and not provide that. We do recommend that you do choose email as your preferred communication, as it's going to be faster for us to get notifications to you regarding this application. So I'm at the end of the first page and I can now save and continue. However, before we do so, I just want to go back to the top of the page to reiterate that once I hit save and continue, I will not be able to move on. I will not be able to change my enrollment type or my provider type. So I'm not going to be able to navigate back to this page and change those pieces of information. I can change other information on this page, just not the enrollment type or provider type, so I want to make sure that these 2 pieces of information are correct. I know that they're correct for today, so I'm going to go ahead and hit save and continue on the bottom right-hand side. The next page that comes up is page number 2, which is the specialties page. You'll notice at the top now I have a progress bar that lets me know where I am in the process. The first page, the general information page, is now white, which indicates that I have completed that page. I can go back to it and review information and change information as needed, except for the enrollment type and provider type. Any page that you're currently working on is marked in yellow. Any pages that you have not yet completed are going to be blue, and you will not be able to go forward and click on those pages out of order. So you do have to go through them in sequential order. You can't jump around. I couldn't go to page number 12 and complete that page and then go back to page 2. So we have to enter in at least one specialty to move on. You'll notice my provider type is listed here. In order to add a specialty, we have this box that will allow us to create a new entry. So to do so, I'm going to hit Create New on the right-hand side. This is going to bring me up another box in order to enter in this information. At least one of the specialties that you enter must be made your primary specialty. So I'm going to check the box and say that this is my primary specialty. I can choose from a drop-down list of specialties that are tailored to the provider type that I selected. So because I chose 005, a physician, I'm only going to be able to select from specialties that are allowed with that provider type. So I'm going to hit General Practice. And then I need to add a taxonomy. And just like the specialties, the taxonomy list is derived from the specialty that I chose. So I'm only going to see taxonomies that are allowed with general practice. And I'm going to choose acute care for today. I have to enter in an effective date for my specialty. Once all that information is completed, you can hit Save. And now you'll notice that I have an entry in the box below. It lets me know that general practice is my specialty, acute care is my taxonomy, it is my primary specialty, and here is my effective date. If for any reason you realize you made a mistake in this entry and you need to change it, you can click on the pencil icon located on the right-hand side. A pencil icon in the module means the field is editable. So say I accidentally chose the wrong taxonomy, I could simply drop the box down again and say, oh, I actually meant to choose this acute care, and then just hit Save. And that's going to change and update that for me. If you had multiple specialties, you would want to simply repeat the process and just not click the primary button. Once you've entered in all specialties associated to your provider type, you can hit Save and Continue. The next page that populates is the Addresses tab, and this is where you're going to give us all of your addresses associated to your group. The first required address is the service location, and you're going to enter in first your billing name. And you want this to be listed exactly how you are going to be billing on your claim form. So I'm going to be billing as DXC Associates, so I want to enter in that information. Next, we need contact information for your service location. So this may be different than the contact information you provided on the first panel, as that was for the specific application, and this is for your service location. So you'll notice that once I tab through the zip code, it is going to go through that USPS software. Every address in the module requires that it is validated. So I'm going to tab through, and I'm going to go ahead and accept the changes. You need to provide an email address for your service location. So I'm going to provide that here and confirm. It's also required that you give us at least one phone number. So again, in order to do so, you want to create a new entry in the box listed here. So I'm going to hit Create New. That's going to populate a new window so that I can put in my phone type and my phone number. And you can add an extension if you need to. You can hit Save, and if you had multiple phone numbers that you wanted to provide to us, say a work number, or a home number, or a fax number, you can simply create a new entry and enter that phone number, and it will all be listed here. Next, we're going to ask you a few questions regarding your service address information. The first is your hours of operation, so you want to click the box next to hours of operation. This brings up a new window in order for you to tell us when this group practice is open. So again, we're going to hit Create New to make a new entry. And you have a multitude of different ways you can enter this information. So you can select that you're open every day, 24 hours a day. So if this was a hospital, you could tell us that you're open all the time. You have the option to select specific days if you work different hours on different days. You can select weekdays and or weekends. So for today, I'm going to select weekdays that we're open a standard Monday through Friday. And I'm going to choose that we are open from 8:30 a.m. until 5 p.m. And then I'm going to hit Save. Now, if you had different hours for different days, say Monday you were open 8 to 5, you could select Monday 8 to 5, and then Tuesday was a different entry, then you would just select Create New again, put in Tuesday, and select the hours you're open on Tuesday, and they would all be listed here. We're going to ask you if the service location is ADA compliant, and is this service location accessible by public transportation. We are also going to ask you what your after hours arrangements are. So if you indicate that you send people to the emergency room or you have a phone service, you would want to indicate that here. I'm going to put ER for today, but if you had an answering service, you would want to provide the phone information for that. The next address that you are required to complete would be your pay to address. Where do we send the payments to? So you have a couple different options. The first would be that you could enter in all the information here if this was different than your service location information. So if you wanted payments to go to a specific place other than your service location, you could simply just fill out the information here. If it's the same as your service location, you do have the option to check the box same as service location, and that will populate the information for you. You can also do that with your email address and phone number. If this is the same as the service location, you can simply check the box and it will populate the information. But if it's not, you have the option to just fill in the new information. The last required address on this tab would be your mail to address. Where do we send mail correspondence to? And again, you have a few different options. If the mail to address is not the same as either service location or your pay to address, you could simply enter in the information here. If it is the same as your service location, you can drop the box down and select same as service location. If your pay to address was different than your service location, but the same as your mail to, you could check your pay to address. So today we're going to check it's the same as my service location. And then we're going to do the same thing down for the email address and phone number. I'm going to drop the box down and say it's the same as my service location for today, but you could enter it in if it was different. One thing that I do want to know on the mail to address, when you choose that it's the same as a service location or pay to, it's going to default your preferred communication to mail. Again, we highly recommend that you choose email as notifications are going to come to you much faster via email. So I'm going to go ahead and change that to email address. You have the option to enter in addresses for prior authorization, remittance, legal, or medical records request. So if these addresses you want these correspondence to go to a specific address, you can give us that information. However, it isn't required to move on. If you do wanted to give us that information, you can simply check the plus sign related to the corresponding address. This will expand the selection and give you the option to fill out the information. Again, you'll notice that it isn't required to complete to move on. However, if you do start entering in the prior authorization information, you must complete all of the information to continue. Once you have completed filling out all addresses, you can hit Save and Continue on the bottom right-hand corner. The next page we're going to fill out is regarding your organization. You're going to need to give us your organization type. So I'm going to drop the box down here, and I'm going to say for today that we are a corporation. You'll also need to give us your tax classification. So again, I'm going to drop the box down, and I'm just going to say corporation. If the registered with Secretary of State, incorporated, chain affiliated, operated by management company, domestic owned, or foreign owned apply to you, you would want to check the boxes here. So for today, I'm going to say domestic owned corporation. If none of these apply, you can leave this information blank. However, if you do choose registered with Secretary of State or incorporated, you would want to give us the business start date and the incorporation date. So I will choose registered with Secretary of State, and I'll say it's from the beginning of my enrollment. Once you've completed all of your organization details, you can hit Save and Continue. The next screen is regarding associations. If you want to associate individuals who are already enrolled as an individual within a group in Vermont Medicaid, you can associate those individuals here. However, this is not required in order for you to move on. So if you are enrolling as a new group and the individuals who are going to be associated to your group have not yet enrolled, they can associate to your group during their application so that it is not required here. However, if you do want to enroll an individual association at this time, I'll show you how to complete that. So in order to create a new individual association, you first want to hit the Create New button. That's going to bring up a new window, and you're going to want to provide the 14-digit provider ID for that individual. You can receive this ID from the individual themselves. However, if you do not know this ID or can't obtain it, you can always get it from the provider lookup that's on the vtmedicaid.com website, or you can contact the enrollment department at DXC. So I'm going to enter in the provider ID for my individual within a group provider. And again, this provider must have an individual within a group enrollment. They can't be listed just as an individual. Once I enter in the number and tab through, you'll notice that the name of that individual has populated here. You need to enter in the effective date of when that individual is associated to you. And chances are you're not going to have an end date for this association yet. If you do, you can enter it in as that date. However, if you don't, we recommend that you just put the end of time. After you've entered that information, you can hit save. And now you'll notice that I have associated this individual within a group provider to my group. If you have multiple associations that you would want to make, you can simply hit the Create New button again and repeat the process. Once you've entered in all of your associations, or if you have no associations at this time and you want to leave blank, you can hit Save and Continue. The next page we are going to work on is the Credentials page. You'll notice that the first credential that it's going to ask for is license. However, this is a group application, so you are not required to enter in a license for the group, as the individuals who are working for the group will have their own license. We are going to move down to the Medicare participation. As you may remember from the very beginning, the first page, we indicated that we are Medicare enrolled. So this is where we're going to have to enter in that Medicare information. So I'm going to hit Create New to start a new entry. I'm going to provide first a checkbox here that says I do want to be considered for Medicare crossover claims. I'm going to enter in my Medicare number, which type of Medicare I'm enrolled with. So I'm going to say that I'm Medicare B enrolled, the effective date, and the end date of that enrollment. Once you've completed all the fields, you can hit Save. If you are enrolled in multiple Medicare types, so say you are also Medicare A enrolled or Medicare D enrolled, you can enter in the information just by hitting Create New and repeating the process and choosing Medicare Part A or Part D or whichever Medicare plan you are also enrolled in. Under the Medicare participation will be a question regarding other Medicaid programs that you may be enrolled in. So if you are enrolled in other state Medicaid programs, you would want to choose yes. You'll notice that a box populates, and we're going to ask you to provide us details regarding that Medicaid program. You would give us the program name, the state, and the effective and end dates to which you are enrolled. If you have no other Medicaid participation, you can hit no, the box is removed, and you can move on. If there is a DEA that you are going to report, you can hit the Create New button, enter in the DEA information, the effective date, and the end date. And you can hit Save. Once you've entered all the information on the Credentials tab, you can hit Save and Continue. The next tab is the Provider Type tab. On this tab, we're going to ask if you hold a CLIA. So if you hold a CLIA, you are going to hit Create New. You're going to give us the CLIA number, the CLIA type, the effective date, and the end date of that CLIA. And then you can hit Save. And you'll notice now I have a CLIA listed here. If you have no CLIA information to report, you would simply not enter anything and hit Save to continue. Page 8 of our group application is the Other page. And this is going to start off by letting us know any languages that are spoken at your service location. I'm going to hit Create New, and I'm going to select from a drop-down list of languages that are pre-populated into this module. I'm going to choose English first. If you had multiple languages, you would simply repeat the process, drop the box down, and select any other languages that are spoken. And you can repeat this process as many times as you would like. Under Languages is Certifications. If you hold any certifications, you can report this to us. However, it is not required. You would just want to let us know the specialty the certification relates to, the certification type, certification number, and the effective and end dates of your certification. If your practice has a website, you can enter that information here. You just want to make sure that the URL that you provide begins with HTTP or HTTPS in order to make it a valid URL in the module. The next required piece of information is the malpractice information. So you want to hit Create New to create a new entry for your malpractice. You're going to tell us which type of carrier this is, comprehensive or professional, the name of the carrier, the policy number, the aggregate coverage amount, and the per occurrence amount. Now you'll notice that I didn't enter any special characters in the coverage amounts. There's no commas or decimals or dollar signs. The module does not support any special characters, so you want to make sure that you stick just to the numeric digits. You need to put in the effective date and the end date of your policy. Once you've entered all the information, you can hit Save to continue. Under the malpractice information will be a question regarding if you currently or have been within the last 10 years involved in a malpractice suit or claim. If the answer is yes, you would hit the Yes button, and this is going to populate a new box for you to give us more information regarding that claim. You would want to provide us the patient or the plaintiff name, the policy number, and the status in your case, or if it's a claim, the claimant or plaintiff information and the status of that claim. If the answer is no, you simply check no and no further information is needed. Once you've completed all the information on the other tab, you can hit Save and Continue. Next, we're going to ask you if you want to enroll for electronic funds transfer or EFT. It automatically defaults to no, and you'll notice there's no other information on this page. So if the answer is no, that you would rather receive your payments by paper check, you can simply hit Save and Continue. However, if you do wish to receive payments electronically, you want to hit Yes. You'll notice that more information populates at the bottom. It's going to list the provider information here, and it's also going to list the provider identifier information. You don't need to add anything to either pieces of this information. It is pre-populated from the information you gave us earlier on in the application. If you wanted to provide information regarding contact, agent, agency, or pharmacy, you can feel free to do so. However, this is not required. If you do want to provide any of that information, you would simply hit the plus button to expand your selection and give us the information here. The information that is required on this page to continue would be the financial information. So first you want to give us the financial institution name. You are not required to give us the financial institution address. It is not asterisk, so you can simply skip this section. You will need to provide a routing number, which type of account this is. Is it a checking or a savings account? And the account number. You have the option to link either your tax ID or your MPI. You can toggle between these two. I'm going to choose tax ID for today. Lastly, I do want to note that there is a submission section at the bottom of this page. You'll notice that nothing is asterisk, nothing is required down here. If you were to select this Include with Enrollment Submission drop-down box, it would say a voided check or a bank letter. We do not require that you submit a voided check or a bank letter to Vermont Medicaid in order to complete this transaction. Once you've entered in all the necessary information, you can hit Save and Continue. We're going to move on to the Disclosures page. This is where you are going to self-disclose and also let us know if you have any other disclosing entities to report. You want to make sure to read over the Privacy Act Notice Statement and the ownership and controlling interest requirements before you begin. All of your disclosure forms are listed here. We have a provider self-disclosure, subcontractor, ownership and control, managing employees, or a business transaction. It is required that you action each one of these forms in order to continue, regardless if you have any of these disclosing entities or not. All of the statuses are new, and we need them all to be complete in order to continue. So the first thing that we're going to do is fill out the provider self-disclosure. This is required for all providers, so you must complete this form. To do so, I'm going to hit Create New on the right-hand side on that line item. This is going to bring up a blank disclosure form with the legal name and the EIN of this group practice. It's going to start by asking a series of questions regarding your enrollment and your license and your affiliations, any convictions or sanctions you may have. You'll notice that all of these questions are pre-populated to yes. It is very important that you read through each question very carefully in order to determine how to answer it. This first question I'll take by example. You'll notice that it does say yes, and there is a box located under the question. If your answer is yes to any of these questions, you want to make sure that you provide us more information as to why you answered yes to that question. I've read through these questions, so I'm going to go ahead and I'm going to answer them appropriately. However, I do want to just stress as I'm going through these, you want to make sure to take the time and read these very carefully before you make any answers. Below this first series of questions, there is going to be a place for you to enter information regarding who to contact in the event of an audit. So if there was an audit regarding this application, who do you want us to contact? So I'm going to enter in the name of the person as well as the address. And again, this may be different from the other contact information you gave us earlier. I'm going to tab through that zip code and it's going to go through the USPS software and I'm going to accept the changes. I also have to provide a phone number. Under the auditing location information will be a place for you to tell us the physical location of your records. So again, this may be different than any other location you have entered. We would just like to know, where are your physical records being kept? And again, every address is going through the address doctor. I also need to put in a phone number regarding where my records are kept. And this is just because if we need to request medical records, we'd like to be able to go right to the contact where those records are being held. Under that information is a question that I would like to point out. This question states, in accordance with 32 VSA, I declare that I am currently not in good standing with respect to any and all taxes due. This means that if you hit yes on this question, you're telling us that you are not in good standing with your taxes. This is why it's very important to read through each question very carefully in order to know how to answer the question. So I'm going to choose no today to state that I am in good standing with my taxes. I'm just going to finish up the last few questions here. And once you've completed this form, you can hit Save to continue. And now you'll notice that my provider self-disclosure is in a completed status. I have completed the requirement for that line item. So just like the provider self-disclosure, I have to action each one of these other disclosing entities. So I'm going to start with the subcontractor disclosure, and I don't have any, so I'm going to show you what you would do in this case. So again, I'm going to hit Create New on the line item, and this is going to bring up a blank subcontractor disclosure form. You'll notice that there's a lot of information here that is required, but we're going to go to the very first question in order to determine if we have any of these subcontractor disclosing entities. The question states, has the provider had business transactions with any subcontractor totaling more than $25,000 during the preceding 12-month period? If you answer yes, you must complete all of the information to continue. If your answer is no, you can simply hit no, and it's going to remove all of that information, and you can hit Save to continue. You're letting us know that you don't have any disclosing entities under the subcontractor forms to disclose to us. I'm going to move on to ownership and control interest, and I'm going to hit Create New again. And again, it's going to state, is there any entity with an ownership or controlling interest in the disclosing entity as described above? If the answer is yes, you will need to fill out the information below. If the answer is no, all of the information is removed and you can hit Save to continue. I'm going to hit yes today so that you can see in a group practice what you would do if you had an individual that has controlling interest of at least 5% or more in order to fill out this disclosing entity form. So again, I'm going to choose yes, and then it's going to ask, is this entity an individual or a corporation? And I'm going to say this is an individual who holds 50% of interest in my group practice. We would need to know the name of that individual, their social security number, their birth date, and their address. All disclosing entities are screened through our screening service prior to your approved enrollment, which is why we ask for this information. The address is still going to go through that USPS software, and I'm going to go ahead and accept the changes. We need an email address for this individual. And like always, we need to confirm it in the module to make sure that we are getting the right information. We need to know the effective date of when this person had started having controlling interest in this group. And it's going to default to the end date to be the end of time. If you did have an end date to report, you could definitely change that here. It's going to ask a series of questions below that. So you'll notice that they all default to yes again, and that there is a box that is required for more information if the answer is yes. If the answer is no to these, the box will go away and you can move on to the next question. So just like our provider self-disclosure form, you want to make sure to read over each one of these questions very carefully in order to understand how to answer the question. Once you've answered all the questions, you can hit Save to continue. Now you'll notice that we've completed our status for ownership and controlling interest. I'm going to move on to managing employees. I'm going to hit Create New to get a blank Managing Employee Disclosing Entity form. And again, the first question is going to state, is there any managing employee entity associated with the provider's organization? As this is a group practice, chances are you do have a managing employee that you would want to report, so I'm going to choose yes for today to show you how to do so. You're first going to let us know what is the relationship of the entity to the provider's organization. You can drop the box down and select from the list below. I'm going to choose that this is a managing employee. I'm going to enter in the information here. I have to enter a last name and a first name. Again, I need to put in a social security number, a birth date, and an address. It's going to go through that USPS software again, and I'm going to select the changes. We do need an email address for this individual, and we're going to need to confirm it. And just like our ownership and controlling interest, we need to know the effective date of when the employee started with the group practice, and the end date is going to go default to the end of time. Just like our ownership and controlling interest, there will be a series of questions to answer. You want to make sure you read over the questions very carefully, and if any of these answers are yes, you want to provide more information in order to be able to continue. Once you've answered all of the questions, you can hit Save to continue. And now our managing employees is now completed. Lastly, I have to action our business transaction. I'm going to hit Create New again. This will bring up a blank business transaction disclosing form. The first question states, has the provider entity had any significant business transactions with any wholly owned supplier or with any subcontractor during the preceding 5-year period? If you choose yes, you will need to enter in the information listed below. If you choose no, that information goes away and you can hit Save to continue. If at any time you want to review your disclosure forms, say you needed to review your provider self-disclosure form for accuracy or the managing employee form that we just did, you can do so by clicking any place in the white area of the line item you wish to see. So for instance, if I wanted to see my managing employee's disclosure form, I can simply click here and it is going to bring up my disclosure form for my managing employees. If you had multiple disclosing entities in each category, you can simply hit Create New and do a new disclosing entity form for that category. And then when you clicked here, it would list all of the managing employees that you had. Once you've completed all of your disclosure forms, you can hit Save and continue. The next page we have is the attachments page. This is where we are going to let you know what is required to attach to your application in order for it to be complete. So the information here is letting us know for provider type of physician with a specialty of general practice, IRS W-9, proof of professional liability, and the CLIA certificate are going to be required. So because we had a CLIA that we entered, it's going to require that certificate here. Currently, you'll notice that under requirement met, we have no listed under each one of these. We have to action each one of these items in order to move on to the next step. In order to action them, we want to go down below on this page under attachment details. In order to action the item, you're first going to hit Create New, located on the right-hand side. The first thing you're going to let us know is how you're going to get these attachments to us. So you have 4 different options to do so. You can choose to send this to us by mail, electronic only, email, or by fax. We highly recommend you choose electronic only and upload them directly here onto this application. The reason for this is if you upload them electronically, once you've submitted your application, it's going to immediately go through our screening service and be put into the queue for DXC and the state of Vermont to process. If you choose to send us your attachments by mail, email, or fax, once you hit submit on your application, it's going to be in a holding status, and it will not be processed until we receive your attachments and upload them for you. So for today, I'm going to choose electronic only. And again, I have to action each one of these attachment types. So the first thing I'm going to choose is my IRS W-9 form. So I'm going to select from the drop down here, and I'm going to choose IRS W-9. And then I'm going to go upload the file from my computer. So I'm going to hit Select Files. I'm going to find my W-9 on my computer. And it's going to upload directly to my application. Once it's in a done status, you can hit Save to continue. Now you'll notice that I have an entry here. I decided to submit it electronically. I'm submitting my IRS W-9, and here is the actual file. You'll notice up top for my IRS W-9 form, the requirement has now been met. I do just want to be very clear that having a yes for the requirement met does not mean that you uploaded the attachment electronically. It just means that you've actioned it down below. So if you did action it and state that you wanted to send it by mail, email, or fax, you would just want to make sure you sent those attachments to us after you submitted your application. So next I'm going to action my proof of professional liability insurance. So I'm going to repeat the process under attachment details. I'm going to hit Create New. I'm going to upload it electronically. I'm going to say that this is my professional liability insurance. And I'm going to go find the file on my computer to upload. And just that fast it's uploaded, so I'm going to hit Save. Lastly, I'm going to upload my CLIA certificate. Again, I'm going to choose electronic only. I'm going to find CLIA certificate. And I'm going to go find the file on my computer to upload. And I'm going to hit Save. Now that all the requirements have been met for the required attachments, I can hit Save and continue. The last page of our application is the Agreement and Submit page. This is where you are going to agree to the terms of Vermont Medicaid's enrollment. The first thing you want to do is read over this section very carefully. You'll notice that it has already populated the legal name and the contact information that you gave us in the very beginning of the application. Down below here, it's going to let you know that there may be provisions regarding your specific provider type, and you want to make sure you review them prior to hitting Proceed. So you want to access the link that's listed here, and this is going to bring you to the vtmedicaid.com website, and it's going to list all the provisions that we currently have. If there are any provisions under your provider type, you want to read over them very carefully. If there are not, you can simply come back here. Once you have reviewed any provisions, you can hit Proceed to continue. Under that will be our general provider agreement, and you want to make sure that you read over this very carefully, as this is what you are agreeing to and the terms are listed in this agreement. You do have the option to print this or to download this to your computer if you so choose, if that may be easier for you to read. Once you have read it and agree to it, you can hit the button that says I agree on the right-hand side. It's going to ask that you confirm your choice that yes, you do agree to the terms and the conditions of the provider agreement. And once I hit yes, you'll notice that the I accept check has been placed. Under the General Provider Agreement, we're going to ask you for the portal registration details. This is the information that would generate after the approval of your enrollment application. This information is going to be sent to the email that's listed here that you're providing to us, and it's going to send an invitation code to the provider portal in order to manage the information for this group practice. So whoever you want to receive that invitation to the portal, you would want to put that information here. Under the portal registration details will be your signature. You're going to be signing electronically. So the first step to do so would be to check the I accept box. Under that, you're going to put your last name and your first name. If you wanted to provide any comments to DXC or the Department of Vermont Health Access, you could enter them here. The last step before you can submit your application would be to enter a verification email ID in order to request a verification code that you need to enter to submit your application. I do just want to be clear that you would want to be ready to submit your application once you hit request verification code, because you only have 10 minutes to use that code before it expires. If you're not ready to submit your application because it needs to be reviewed by somebody else, or you just want to submit it at a different time, you can hit the Finish Later button, and this will take you out of this application, and you can resume your application using your ATN or your application tracking number that you were assigned at the beginning, along with the password that you used when you registered. We are ready to submit our application today, so I'm going to hit Request Verification Code. And that's going to be sent directly to the email address that you provided up above. Once you receive that verification code, you want to enter it in exactly as it is stated in that email. So for instance, if you have capital letters in your verification code, you want to make sure that you capitalize them here. If you were to use a lowercase when it expected a capital, it would not accept that code. Once you've entered in the verification code, you'll notice that the Submit button is now ready to hit. So we are going to go ahead and submit our application today. Once you hit Submit, it's going to alert you to confirm, do you actually want to submit this application? And yes, we do. Once you've submitted your application, you're going to receive a confirmation that says you've successfully submitted your provider enrollment application. It's going to provide you your tracking number again for reference. It's also going to provide a cover sheet. In the event that you chose that you want to send your attachments via email, mail, or fax, you would want to access this cover sheet and send that along with your attachments so that we know which application these attachments go to. If you want to print your application, you do have that option. You can simply hit the print button located in the top right-hand corner, and that will give you your complete application in a PDF file that you can either print or download to your computer. If you have any questions regarding your application that you've submitted, we provide the contact information for the DXC Provider Enrollment Team. Feel free to email or to call the number listed here. Thank you for visiting this training video today. Have a great day.